Hey everyone, and welcome. Let's get started on this really essential training. Today, we're going to be talking about something that's absolutely at the heart of what we do here at eMend Healthcare, medication-assisted treatment, or as you know it, MAT. And look, this isn't just about checking a box or following some rules. This is about saving lives.
Let's just cut right to the chase. If there is one single thing you take away from our time together today, it has to be this. MAT saves lives. And that's not just a nice slogan we put on a slide, it is a hard fact. It's the entire reason we're all here today. We have a moral and a legal duty to offer this life-saving treatment, and our job is to make sure we do it right every single time.
So here's what we're going to cover. First, we'll really hammer home why MAT is such a lifesaver. Then we'll get into our legal and clinical mandate, why this is so non-negotiable. We'll talk about the key medications and exactly how referrals work. We'll cover protecting our clients' rights, which is huge. And finally, we'll nail down exactly what your role is in upholding all these standards. All right, let's jump into our first section. It all starts with this core principle. MAT saves lives. And for us, this isn't just an idea we like, it's a deep commitment. It's our promise to give our clients the absolute best care we can, based on solid evidence and, basic human compassion. This isn't some side program. It is central to our entire mission. So what exactly is MAT? Well, the official definition is right there. It's the use of FDA-approved medications, and this is key, in combination with counseling and behavioral therapies. But I like to think of it more like a bridge. It's what helps our clients get from a really chaotic, unstable place to a place where they can actually start to heal and recover. The medication isn't the whole answer, but it's a crucial tool that gives them the stability they need to do the hard work in therapy. It's the whole package working together. Okay, so we know what MAT is. Now let's talk about why this is such a big deal. Look, this goes way beyond just having good intentions. We're talking about following the law here. The state of California has been crystal clear. We have a legal and clinical mandate to provide MAT to our clients. And that's exactly why this training isn't optional. It is absolutely required for every single person on our staff.
These laws you see here, they're not just numbers on a page. This is the state of California telling us loud and clear that the old way of doing things is over. No more excuses. We are legally required to make sure our clients can get MAT. That means we either have to provide it ourselves, right here on site, or we have to connect them through a solid, effective referral process. There is just no wiggle room on this. It's our duty. All right, let's tackle this one head on, because it is so important. Stigma has absolutely no place here at eMend Healthcare. The words we use matter a lot. So let's be perfectly clear. Language like not really clean or calling MAT just another drug, that's completely unacceptable. It's not just wrong, it's harmful, and we will not tolerate it. Our standard is to talk about this for what it is, evidence-based care, a legitimate medical intervention, period. Okay, let's get into the practical side of things. We've covered the what and the why, so now let's talk about the how. This section is where we'll dig into the actual medications you'll see and what our referral process is supposed to look like. Because to do this right, we've got to know the tools of the trade inside and out. So here's a quick look at the main FDA-approved medications. As you can see, we have options for both opioid use disorder, that's OUD, and alcohol use disorder, or AUD. But the really key thing to pay attention to is that last column, how we provide it. For some of these, we can handle it right here on site. For others, like methadone, it's always an off-site referral to what's called an opioid treatment program. The bottom line is this: no matter what a client needs, we have a pathway to get it for them. Now, I really need to stop and focus on this for a second. The phrase effective referral is an actual legal term. It has a specific meaning, and let me tell you what it is not. It is not handing someone a pamphlet or a phone number and just wishing them luck. That does not count. That's a passive referral, and it doesn't satisfy the law. We have a duty to be active participants in this process.
So what does an effective, legally compliant referral look like? It's these 4 steps, every single time. Step 1, we establish a relationship with the provider we're sending them to. Step 2, we don't just tell them to call, we actively schedule the appointment for them. Step 3, we arrange their transportation. This is not optional. We have to help them get there. And step 4, of course, is we document every single thing we did. This is the process. This is the law.
Okay, let's move on to something that is absolutely central to everything we do here: protecting client rights. This is a big one. And these aren't just best practices or nice ideas. These are non-negotiable standards of care that are protected by law. So let me ask you a question. This is a scenario you might have even seen or heard about somewhere else. Can we require a client to start tapering off their medication as a condition for staying in our program? The answer is a simple, absolute No, that is illegal. Forced tapering is prohibited, full stop. Here at eMen Healthcare, we will never, ever do that. A client's decision to be on MAT is between them and their doctor. We do not get to make that decision for them.
Okay, next question. Can we deny services to someone just because they happen to be on a medication like Suboxone or Methadone? Can we say, sorry, you can't be in our program or you can't come to this group because of their MAT?
Absolutely not. That is discrimination, and it is prohibited by law. A person's status as a MAT patient has zero bearing on their right to access all of our services. Everyone gets equal access to every single program activity we offer, no exceptions.
All right, one more scenario here. Let's say a client is struggling with participation. Maybe they're missing groups. Can we use their medication as leverage? Can we say something like, well, if you don't participate, we're going to have to withhold your meds?
Again, a hard no. Medication is not a bargaining chip. It's not a reward for good behavior that we can take away. It's a medical intervention, just like insulin for a diabetic. A client's access to their prescribed medication is never ever contingent on their participation in other activities.
Okay, so we've covered a lot of ground, but now we get to the most important part, your role. Where do you fit into all of this? Because upholding these standards isn't just up to the medical team or the counselors. Every single staff member is accountable. So let's break this down. Everyone has a specific vital role. Our medical staff, our MDs, NPs, PAs, they're the ones prescribing and overseeing everything. Our incredible nurses are on the front lines, administering meds and monitoring clients. Our clinical staff, our counselors and case managers, you're educating clients, making those warm referrals, and building all of this into their treatment plans. And our non-clinical support staff, our BHDs, our drivers, you are our eyes and ears. You're providing transport, observing clients, and you're the ones who will alert clinical staff if something seems off. Everybody plays a crucial part. I want this number to stick in your head, 24 to 48 hours. That's it. That is the maximum amount of time that can pass between us identifying a client with opioid use disorder and getting that referral process started. Why? Because speed saves lives. That window is when we are most at risk of losing them to the streets. Every single hour matters.
As we start to wrap this up, I want you to think about this. Being compliant with the law, that's the absolute bare minimum. That's the floor. Our goal here, our real goal, is to build a culture where MAT isn't just tolerated, it's truly embraced. We are aiming for the ceiling, not just trying to stay off the floor.
And maybe the most important takeaway of all is this one. If you are ever uncertain about a procedure or a situation, you must ask your supervisor. Never, ever guess when it comes to client care or medication management. It is just too important. There are no stupid questions here. So I'm going to leave you with a question to take with you, not for next week, but for today. How will you personally and actively contribute to a stigma-free environment for our clients on MAT? Think about that as you go about your work. Thanks, everyone.